Hello, my name's Christopher, and I will be talking today about my PDSA proposal, a change in handoff procedure. This is for my Tier 3 clinical ladder project. For the sake of brevity, I will be covering only the main points. Further details can be accessed via PowerPoint or reaching out to the Elmhurst ED night shift staff. Handoff is a communication process by which patient-specific information is passed from one caregiver to another. In this instance, it will be between units, primarily between emergency department and medicine floors. Presently, handoff is performed via telephone while both nurses go through the patient's chart through an electronic medical record. Many factors can delay handoff, such as the inpatient or emergency nurse being pulled away from the phone to tend to the bedside. This results in both parties having to synchronize in order for the patient to be ready to move to the admitting unit. In addition to phone interruptions, noise, alarms, and multitasking in an overcrowded environment, they all negatively impact the ability to give a report. With multiple phone calls being made, time is lost that could be used to tend to other patients or assisting colleagues with procedures. This will occur multiple times throughout the night, resulting in delays. The triggering issue for this proposal is that as of the 2018-2019 report on the New York State government's hospital listing, that the admit decision time to ED departure time for admitted patients for Elmhurst was 360 minutes. The national average is 103 minutes, and New York State's average is 153 minutes. The focus here would be on the time in which the bed is assigned to when the patient departs. Of the 11 acute care hospitals in the HHC system, we are ranked 10th in the admit decision time to ED departure time for admitted patients. Overall, we are ranked 146 out of 151 hospitals in New York State. The purpose of this proposal is to explore an alternative to the present handoff process. The model presented is based on the research published in the aforementioned studies on electronic handoff. The two hospitals were able to decrease their bed assigned to ED depart time from 84 to 49 minutes, and the other from 97 down to less than 60 minutes a year after implementation. Verbal handoff lacks standardization and content, which may result in inadequate and inconsistent information, lengthy handoff timeframes, and many interruptions in the handoff process, all of which can have a negative impact on the quality and safety of patient care. Use of information technology has been shown to enhance communication through standardization of the nursing handoff process. Real-time information from the sending to the receiving nurse automates and streamlines the nurse's workflow, closing gaps in communication and response. Furthermore, using technology to facilitate the nursing process is a way to address the problem of boarding. In conclusion, a change in policy can lead to benefits to patients by having less time spent transitioning to the admitting floor. Nurses would benefit by having to spend less time on the phone giving and receiving report, and the hospital benefits via a change in perception by patients of the emergency department's timeliness. Now, all of this is just an idea. I can't make it a reality without your help and input. I want to make our workplace not only better for us nurses, but patients as well. You all know the saying, nurses are patient people. Thank you.